Alrighty, and we're live. Hi everyone, I'm Alex. This is the wonderful Beck. Beck is our absolute favourite naturopath. She is a whiz and a half when it comes to everything preconception, prenatal care, nutrition, supplements, anything you need to know in that area. She is your girl. So we are incredibly lucky to have Beck with us tonight to talk about anything prenatal and preconception related. So we're incredibly lucky to have you here, Beck. Welcome.
Oh, thank you. I'm so excited to be here. And I must say, this is only my second Facebook Live ever, so this is exciting in itself.
Yeah, we're lucky to have trouble tonight, don't we?
Sorry, Joe. I think my connection's a bit dodgy.
All right. Have some connection trouble as well as going today. So everybody stay with us. We're working through it, but if anything changes, we will let you know. And go from there. Cool.
Good.
So, Beck, we have heaps of people ask all the time about supplements and diet and do I eat paleo? Do I eliminate dairy? Do I do this? Do I do that? In the lead up to conception and preparing their body for a baby or looking after the baby that they've already got growing inside them. So why is it so important to really consider that? Because sometimes it's a difficult thing to explain to people why we need to look after ourselves so long prior to conception.
Mm-hmm. Yeah, for sure. So there's probably many aspects to that question that I could answer. Probably firstly to say that obviously in my profession when I'm seeing patients, they're often coming to me mostly because they may have encountered difficulties conceiving already and they're looking for some extra care. So they are often the patients that do need a little bit more tweaking around the diet and supplementation. So it's not to say that everybody is going to encounter difficulties, but I guess specifically in relation to that question, the reason we bang on so much about preconception care and that kind of magical window of 3 to 4 months, before the time you ideally want to try and start conceiving, why that period of time is so important is essentially because that is the life cycle of the follicle or the egg that you're hoping to conceive with. That's how long it takes to pick one, mature it, and ovulate. So if somebody is coming to me and they've got some health issues to overcome or potentially some nutritional deficiencies or, anything, that's the period of time for us to potentially be able to have a positive influence on that next healthy ovulation, 4 months down the track. So you have the capacity or the scope to actually really positively influence the health of the DNA of the egg. And then I guess conversely, when we're looking at the health of the sperm, which is equally important, that's about 76 days, I think, so give or take 80 days for us to have a really positive influence on the DNA of the sperm as well. So it sounds really clinical when we sort of really recommend that to patients, but we're doing it to really make sure that we have a positive outcome and avoid any miscarriage or really lengthy time for people to conceive.
Yeah, and it shocks people, I think, to hear, that we need to look at pieces but for such a long time prior to even trying to fall pregnant, that it's a bit of a shock for some people when they hear us mention that for the first time, and particularly the guys out there. I'm hoping my husband can hear me from the other room, because suggesting to some of them that is important for you, and it's for even longer for them really than it is for women. It's a huge part of it.
Yeah.
So what sort of things do you look at then when you're telling someone, this is what we want to aim for, this is the goal here, and this is for how long? What sort of things are you really banging on to them about to change, I suppose, in the lead up
to that? I guess broadly speaking, obviously in a consultation we'll be taking a really, really detailed case history. So it can really depend on what might pop up, but generally speaking, we talk about, avoidance of the usual suspects. So excessive alcohol consumption, because that is quite damaging, whether they're taking any recreational drugs, obviously taking into account any diagnosed health conditions which can have an impact and influence on a couple's fertility, or a woman's fertility if she's going through it with a sperm donor. I think it is just not trying to get too fancy. I think people come to a naturopath and they think, oh my gosh, she's going to take everything away. I'm going to be living on salad and, a paleo diet. 90% of the time, I'm just really bringing things back to whole, clean foods. I'm not necessarily taking everybody off gluten or taking everyone off dairy. It's really about going, okay, well, the quality of your food is probably the most important thing to consider. So minimal processed foods, ideally trying to, grow your own biodynamic, organic where you can and where you can afford. Just choosing the quality of your food more than going on a restrictive diet. So if you do want to have some gluten, an organic sourdough is always going to be better than a fluffy white loaf, So I think for the first consultation is really just about bringing people back to minimal processed foods, minimal alcohol, looking at their caffeine consumption, because that can be pretty high for some people. And then I guess if and when we need to, we can talk about getting a little bit more specific or restrictive if we need to. Yeah.
And I know you mentioned health conditions and things like that. And sometimes we'll have people go, I'm taking this medication and I'm worried about that because I know it's not great for this, or it has this side effect. Is there any that you kind of flag? And there may not be, I don't know, but are there any that you kind of go, keep an eye out for this sort of medication, or for how this interacts with your system, your diet, your body in general?
It's probably more if people are taking recreational drugs or taking something regularly that they don't really think is a big deal. So somebody might be managing a sore back and popping 6 Nurofen a day, or, codeine every night before bed, and no one's really ever said to them, hey, maybe that's not such a great idea. I am probably one of the more mainstream naturopaths that you'll come across, in that I'm a big supporter, believer, whatever you like, of, if someone comes to me and they're on a necessary medication to manage depression, anxiety, anything like that, they will have my full support. So I guess unless their doctor has flagged that that's particularly to be avoided in pregnancy, then, I'll just support that patient exactly the same way. Things that potentially can come up is probably more historical exposure to certain medications. So loads of antibiotics will have an influence on their gut flora and microbiome, which often needs to be addressed in preconception care. Certain medications can be quite damaging to the liver. We shouldn't mention them on here, but there are some really known ones where people will actually have to get liver function tests while they're on the medication. That's why it's so important.
That's not even, after they come to you to say, hey, this is what we're trying to achieve. That's just, they have to do that anyway as a prerequisite, I suppose, to taking the medication in the first place.
Oh, sorry, Dal. I just missed that first bit of the question.
Don't stress. All good. So tell me more about how you really know if you're healthy, because sometimes people go, yeah, no, I'm great. I exercise every day and I eat well, and I have a few drinks on the weekend and rah, rah, rah. But how do you know? Because sometimes trying to explain to a patient that, optimal health is one thing, but then being healthy is another. So what are you looking for? Are there tests? Are there, is there a checklist?
There is. There is in my consults anyway. It is a really good question, because I think a lot of people don't necessarily have an awareness about whether they are at their peak health or optimal health. We get so used to going through the motions and just feeling tired and getting to the weekend and, that we often don't really think that there could be a better version of yourself. So there's probably two ways of looking at that. Is certainly going through, as I mentioned earlier, really good questioning. So asking people, what's their energy like? Are you jumping out of bed at 7 o'clock in the morning feeling amazing, or are you really dragging your tail until lunchtime? And that can really highlight certain deficiencies in adrenal dysfunction, which can then affect hormone regulation. We talk about gut health, let's get really honest here. We're all health professionals. How often are you pooing? Is it healthy? Are you getting stomach pain? Are you getting headaches? And people will start going, oh, yeah, I just thought that was normal. So you start getting them thinking.
Patients that happens too, that you go, oh, you're experiencing headaches? Oh, yeah, but only every other day. Yeah. But people don't, until you bring it to their attention, I don't think they really go, oh, hang on, that's not to be happening every day.
Yeah.
Yeah. This whole lag is driving us crazy. And tell me more about the testing and stuff that you're doing.
Yeah. So true.
Such a lag here, guys.
Sorry. I'll hop to it. So the second part to that was obviously routine screening or tests that I suggest for both men and women to get. I guess primarily if we want to focus on the woman, just for hypothetical sake. It is not uncommon for me to see women who may have already, been to their GP and said, I want to fall pregnant, ideally, and they'll do there's a set pre-pregnancy screening that they'll do, which will check their rubella antibodies and do an STI screen, which is important. But really frequently I see, iron studies aren't done, vitamin D is not done, there's no thyroid function checked. And I can appreciate that from a medical GP's perspective, that they need a reason to test those things to warrant justifying Medicare rebating them for that. But I think preconception care is the prime time to be in optimal health. So the very basic bare minimum, I highly recommend women getting iron studies. I cannot tell you the proportion of women I see that are either anemic, severely anemic, or borderline anemic, which has a huge influence on menstrual regularity and hormone health and immune function, energy, libido. So certainly iron, vitamin D, I could literally talk for hours about vitamin D and its importance on immune modulation. There is a lot of studies and evidence floating around about vitamin D and its importance in intolerance and allergy prevention in children. It's sort of in its infancy, but it's pretty promising. And thyroid function, because a lot of women have underactive or sluggish thyroid function, which can be a direct reason why they may not be falling pregnant. So they're pretty routine, justifiable tests, but all too often not even done. And probably the last one I'm really, really big on, if a woman's cycle is regular, like it's coming roughly every 28 to 30 days, I get a lot of value out of getting some hormone tests done on day 21 of their cycle. That's probably the most important one for me, because I can tell so much from that. And for the blokes, I guess it's just a good general nutritional workup. Iron, vitamin D, thyroid function, full blood count, liver function, and I guess if there's anything flagging from their history, adding anything else that feels relevant. So yeah, it's a bit of a non-negotiable for me that I absolutely will highly recommend that they get some testing done, so that we know what we're treating and that we can make sure that we're not missing anything. It's very easy to plod through life and not realise you've got ferritin sitting at 6 when it should be 80.
Well, and also I think as a health professional, sometimes, all too often we see people that kind of go, oh, let's try this. And if it doesn't work after 6 weeks, then we'll try this. And if that doesn't work after 4 weeks, then we look at this. And you can understand why people maybe go down that path. But at the same time, when we're talking conception and you've been trying to fall pregnant for a year, 2 years, 3 years, and all of a sudden someone's throwing another 6 weeks at you, sometimes it's easier just to go, right, let's work out exactly what's in front of us and go from there. So
absolutely, yeah. I would say I have considerably changed my practice over the last maybe 7 to 8 years. And I say to patients, look, I can probably clinically pick up some pretty good clues about what's going on. But yeah, we could spend a month or two barking completely up the wrong tree. So if we are able to get some testing done to give us some direction and some black and white answers, then we'll know what we're doing is appropriate. I guess where that can be hard to swallow is I do see a lot of patients that have obviously been trying to conceive for many years, and it's not uncommon for them to be in their very late 30s, early 40s. They don't have time to wait. So often in those cases, if we don't have the data, then I will do some safe supplementation prophylactically and just make the assumption that they need these nutrients based on what I can clinically gauge.
Yeah, it's really tricky, really tricky. So you touched on if you've got a normal cycle and that's kind of something that you will keep an eye on. What is so important? I mean, obviously, we work with this sort of stuff quite a bit and understand maybe more so than the average person how much of a role hormones and stress can play on hormones and this can play on that and really what your cycle tells you. But what is it specifically that you communicate to your patients as to why the length of the cycle, when they're ovulating, all of that stuff is so pivotal to how this all works?
I'll try and give you a concise answer because I could talk about this all day. The long and short of it is for pregnancy, let's keep it really simple and to the point. For pregnancy and early pregnancy maintenance, so avoidance of miscarriage, we need really good, healthy levels of progesterone. And it is really, unfortunately, common for me to see women with very low levels of progesterone. So to give you a bit of a value, I guess, in mind, if we're looking at a woman's progesterone on day 21 of her cycle, assuming that the cycle's 28 days, that would differ if the cycle is longer or shorter, but if we stick with a normal cycle, on pathology results, that can technically vary from anywhere from 5 up to 95 and be normal. Okay, so not uncommon for me to see progesterone levels of around 20, 25. So just to go back a tiny step, we don't start producing progesterone in our cycle until we ovulate. Okay, so if you don't ovulate, you don't make progesterone. So having progesterone levels, in my opinion, sitting above 40 is optimal and ideal. 60 or but I rarely see that. So I'm very often working on herbs to support the body's natural progesterone production. And I guess the flip side to that is very, very, very common for me to see what we would call or coin estrogen dominance. So, you know, if you have little levels of progesterone, you've got this estrogen that's kind of taking over and being the boss. And from a physiological perspective, that creates inflammation. That's often why women will get heavy bleeding, period pain, clotting, periods, migraine, and then the low progesterone symptoms will be the breast tenderness, sugar cravings, feeling like a crazy person, up, down, all over the place, crying, angry, really common to be on the emotional roller coaster. So I can tell a lot from that. And
it's tricky too, because I think when we, you know, often women are going through all those things, like you say, not knowing what they want, up and down in terms of emotions, because they're trying to conceive and it's not being successful. So a lot of people just downplay that. Oh, there's nothing wrong hormonally. Like everything's healthy. I'm within normal ranges. And it's not until you have someone like yourself come in and go, well, actually, this might be what's going on, that, you know,
Yeah.
brought to your attention.
Yeah, absolutely. And I think probably the conversation I have the most in clinic, because I do see a lot of women and women's health and fertility, is that them getting to understand that there's such a wide range of normal, that, you know, actually getting the balance and the ratio of those two hormones right is actually the key to having a really healthy cycle, and the key to increasing your potential for fertile window, or, you know, potential to conceive and maintain that pregnancy. So yeah, so important and so overlooked and so misunderstood, I think, unfortunately.
Yeah. So to kind of recap on, obviously you've spoken about diet and what sort of foods and things like that. If you had to give someone your 5 top tips, so to speak, or your 3 top tips, whatever you think, in terms of what they take away from this, what, without, you know, going into particular supplements or whatever, what would you be telling everyone that, you know, that can be following to be doing at home? Putting you really on the spot.
Fly wants to hang around. No, it's okay. On the spot's good. That's what I do for a job. I get questions fired at me flat out. Top 5, maybe in no particular order. I think it is important to get an idea of what your health is like pathologically, so through some blood tests, and perhaps, if indicated, I really strongly recommend for a lot of women having a pelvic ultrasound, because they often have undiagnosed polycystic ovaries or a fibroid that has been missed or undetected. So thorough screening, that can include a semen analysis if there has been quite a period of time of not conceiving.
Yeah.
So yeah, a good workup. I think, without being super specific, getting to a place in your life where you feel like you have good balance, relatively speaking. I know this can be really hard to achieve, particularly for those patients that have been on the fertility roller coaster for years, but it really is that regular exercise, good night's sleep, respecting your body, and putting everything good into it, you know. So 3 to 4 months pre-conception, really have a good hard look at your alcohol intake and ideally cut it out, or keep it to a really low consumption, maybe 1 or 2 glasses a week. Ideally keep your coffees down to maybe 1 or 2 max, depending on your reliance. Without doubt, a good preconception multivitamin. There are some not so great ones out there, so that I do advise getting some practitioner or professional recommendations to make sure you are getting adequate folate, adequate iodine, zinc, all the necessaries. And I think for the women, it's really understanding their cycle. I have women who don't know what ovulation is, or when it is, or how to look for it. How do I know when I'm ovulating? Why am I ovulating on day 10 and then getting my period on day, 24? So it's educating yourself, or me educating my female patients about understanding their cycles and their fertile window is, why they're feeling a certain way, how we can actually have an influence on that. So yeah, they're probably my main tips, I guess.
Yeah, no, I love it. It's so good. And I think you'll have sparked a lot of conversation for people with our conversation and this live, because like you say, people often don't know, and it's not until, obviously you and I have a huge interest in all of this, but for the average person, it's not until we start going down the path of conception or trying to start a family or navigating our cycles that we go, oh, why is this important and what does that mean? So I think it's really valuable information to take home. So that's great. Yeah. And we will have Beck on as well a little later in the year. She is presenting in one of our interactive webinars where we are going to delve into this stuff even more so to really help you all in that area. So make sure if you've got questions, still post them below. We will get to them eventually between Beck and myself at some point. And definitely don't hesitate to reach out to Beck either. She is doing Skype consult, yes, at the moment. with all of the COVID stuff going on. So she's still accessible if you've got questions for her. And I will pop all of the links to her page and website, etc., on this post as well. So thank you so much for joining us, Beck. It's been so wonderful to have you on. Guys, stay tuned as well, because this week we have our interactive webinar with Ginny Fang Davey on Thursday night. So still time to get your tickets for that if you haven't already. And we will see you all soon.
Thanks.
Bye.
Bye.